Right, in this next unit, we're going to be looking at injury prevention and the rehabilitation from injury. What we need to know about different types of injuries, about 10 we need to know in total. We need to define them as either acute or chronic, and either hard tissue or soft tissue, and we'll come on to that later on, with explaining what they are. Once we know what the injuries are, we need to look at factors that can help prevent injury. So things in different sports, different rules and regulations, etc. Preparation, how those risk factors and preparation prevent risk for injury. Once we're at the moment of injury, we look at kind of like an immediate response to the treatment, maybe like on the field response, or like in that the sort of moments after the injury is sustained. And then finally, for those of you looking at maybe a career in physiotherapy, we look at the different rehabilitation processes that can go on once an injury has been diagnosed, in the sort of maybe days, weeks, and months after that. Right, before we get into the specifics of injuries that we need to cover for the course, we just need to go over these two points of an acute injury or a chronic injury, and a hard tissue injury or a soft tissue injury. So each injury that we cover is going to be classified under those four criteria there. Now, an acute injury is an injury where the player in one moment isn't injured, and then there's a sudden trauma or a sudden impact, and then they are injured. So in the instance of a tackle in football that results in a broken tibia, that will be an acute injury, because as the player goes into the tackle, they're not injured, and then as a result of the impact during the tackle, it causes a fracture to the leg. So that, the moment after the injury, they are injured. With a chronic injury, they're injuries that develop over a period of time. So it might be that if a fast bowler in cricket complains of increasing pain and discomfort in the shin, and then bit by bit, week by week, that pain starts to get worse, and then eventually they're diagnosed with a shin splint injury, which is an inflammation of the tibialis anterior. Some of you may have suffered from Osgood-Schlatter's disease in your childhood and through your adolescence, which is a knee injury that develops over time. So whereas the acute is in a moment, the chronic is something that is like an overuse injury that happens over time. In terms of hard and soft tissue injuries, the hard tissue is anything that involves the bone, the joints, the cartilage. So things like fractures and dislocations are known as hard tissue injuries, whereas soft tissue injuries are looking at the ligaments, the tendons, the skin, the muscles, things like that. So the example I gave earlier of being the football player breaking the tibia in a tackle, that will be classed as an acute hard tissue injury, whereas that fast bowler in cricket who develops shin splints, that will be a chronic injury because it develops over time, and it's a soft tissue because shin splints affects the tibialis anterior. Now we have an understanding of what acute, chronic, soft and hard tissue injuries are. You're going to be now given the task of researching one or two injuries that you're going to feed back to the class through a presentation and a handout. Now I'll share the group shortly and the injuries that you've been given. Now what I would like to do for each injury that you're given, I need to describe what the injury actually is. So, what are we talking about now? Describe the signs and the symptoms of the injury. Now a sign of the injury is what you see. So if a patient or a player has fractured their tibia, a sign might be a sort of deformity in the lower limb, so that it might not be sitting straight. Symptoms is what the patient actually feels. So the player on the field, when they're down after that broken tibia, what they're going to feel is obviously going to be intense pain. The limb's immobilised, they can't actually move it. We need to describe how the injury is caused during the game, so specific examples of how it's caused and what reason there would be for getting that injury. And then we need to classify it under the four categories that we've explained previously. So is it acute, is it chronic, is it a hard, or is it a soft tissue? So you're going to prepare a presentation for this that you're going to deliver to the group for each of the injuries that you're given. And I would also like an A4 fact sheet on the injury. You can include images of like what the injury looks like, I suppose pictures of like the bones of the joints, whatever we've got, so we can have a specific look about what it's actually like. The handout you're going to be given is going to be the work that's given to everyone in the group. So we need to make sure it's good, because the work you do is going to obviously benefit everyone else. And equally, if people do a bad job, it just means the rest of the group need to go and do a bit of research on your injury. So I'll share the groups now. I'll tell you which injuries that you've got, and then we'll have a week to come up with the presentation and the handout. Now the handout, I will need emailing to me the day before the presentation to give me a chance to photocopy what we've got. If you want to do a test on the injuries you've got, that's fantastic. Some questions would be great, so that people listening can see what they're doing. Here are the groups I've put you in. I've put the groups for both teams in there. Obviously, that 13E for your group, 30C for your group. So see the group you're in, see the people you are working with. The best thing to do in group work is maybe nominate one person who's going to take, sole responsibility for collecting all things together. I need each group to have emailed me the handout that you want, so I can get it printed out, ready to go for the lesson. There's your groups, and in terms of what you're going to be doing, that is now going to follow. So here's what each group are going to be looking at. So group 1 and 2 have 3, whereas 3 and 4 have only 2. But abrasion, blister, and contusion are quite small injuries, and there's not a huge amount we need to know about them, so it shouldn't be too taxing to have that extra one. So remember, what I need is a presentation, a detailed handout on each injury, and what I need to know is like what the injury actually is, how the injury is caused in sport, the signs and the symptoms of the injury. Signs, what we see. Symptoms, what does the injured player feel. And then we need the fact file on there. So remember, email me the fact file so I can get it printed out. And any questions on this, please get in touch with me.